Hi, everyone. Welcome to our webinar today. The topic is really exciting, digital literacy as an equity-focused strategy for older adults. I'm Diane Oikel. I'm a knowledge translation specialist with the National Collaborating Center for Determinants of Health. I'll be helping host and moderate the discussion today, but we have speakers and breakout room facilitators and lots of folks who are here to support it. So thank you very much. A few little housekeeping items as we get started. There is French interpretation available. If you click on the bottom of your screen, there's a little globe icon. If you click the globe icon and select French, then you will be able to hear the French language audio. And if you click it again, you can also mute the original audio, and then all you'll hear is the interpreter instead of hearing both languages going. We also have English closed captioning available, and you can access this by clicking the little CC caption button at the bottom of your screen. We will be recording, or we are recording now, and we will be keeping some notes. We will track the resources that and notes that are in the chat box that get shared both during the main part of the webinar and also during the breakout rooms. We will compile all of that and share that with folks after the webinar. We'll be posting the recording for folks to access if they've been unable to attend today. And we really hope that you'll use the chat box for conversation, for connecting with each other, to introduce yourselves, tell us where you're calling in from, what you're hoping to learn from today. We have other members of the NCCDH team that are in the background here that are going to be monitoring the chat box, sharing some additional links and resources, and also gathering any questions that you have for our main speakers, and then also after the breakout rooms. Please put them in the chat box and we'll pull those together and pose them to the speakers at the end of the Q&A session. And we will also later on be linking to an evaluation from the chat box that we're hoping you'll fill out. And before I go any further, I do want to acknowledge with thanks and gratitude and humility that I'm joining you from Mi'kmaq, which is the ancestral unceded territory of the Mi'kmaq people. I am in a community otherwise known as Antigonish in the province otherwise known as Nova Scotia. And because we are a national organization, I extend this gratitude and this thanks to all of our First Nations, Inuit and Métis communities from coast to coast to coast. And I'm really thankful. We have a number of Indigenous scholars and elders who we at NCCDH have been drawing on, communicating with, developing relationships with, that are really guiding our work in a more meaningful way now than ever before. And we're really growing as a team because of that. And we all very much appreciate it. Many of you know that we are one of 6 national collaborating centers located in different provinces across the country, from Nova Scotia all the way through to BC. So I would encourage you to go to the website to find out a little bit more about all 6 of the NCCs. We are the only one that's located in Atlantic Canada. And this is a little bit about us at the National Collaborating Center for Determinants of Health. This is our website. We have a pretty extensive resource library, lots of supportive resources, lots of new things on our website, and good contact information, and really encourage you to share this and get in touch at any time. Which really brings us to today. So, these are the objectives of today's conversation. It's a big one. We're doing this in a different way than we've done any of the other webinars in this series, which is exciting. We have participants today online who registered from across Canada, but we also have folks from France, Belgium, Switzerland, the US. We have folks from education, government, clinical, parks and recreation, seniors organizations, gerontology, the Red Cross, folks from Public Health Agency of Canada, World Health Organization. So lots of variety in the organizations and sectors represented. We have folks from community health boards, health promoters, dietitians, nurses, epidemiologists, volunteers, patients advisors, program consultants. So we have also a wide variety of professions. And I think that that really speaks to the interest in this topic, but also the fact that this topic of, health for older adults and health equity for older adults is something that does not just live with public health. It doesn't just live with health promoters. It lives across sectors, across professions, and across all stages and places in the health system. And we have a number of speakers today. So you all are very familiar with Irv Rootman from Health Promotion Canada, and Fran Grunberg. I really want to do a special thanks and acknowledgement to, Fran's not actually speaking today, but she has been a mastermind behind the webinar and pulling this together and conceptualizing. And so she and Irv have been really, really formative. Our main speaker is Lorie Donelle. Before I introduce her, I'll also let you know that we have a number of breakout room facilitators who I'll list and name a little bit later on, and who will each introduce themselves. And I'll give you more specifics about the breakout rooms when we get to that point after Lorie speaks. But I'll let you know now that you'll all know, of course, from registration that we asked you to choose a breakout room topic. And that really was important and helped inform us for planning today, to let us know where folks' interests were and where folks wanted to take the conversation. But we will be asking you to choose your breakout room today. So you won't be pre-assigned to the one you already chose. Lots of folks change their mind. Lots of folks may have an idea now and may change their mind after Lorie speaks, which is good. And so we really just want to accommodate where folks are today, what folks want to hear about and learn about today. And I'll give you a bit more detail when we get there. And last thing I'll say before I introduce Lorie is just that I have 3 colleagues in the background here who you probably won't see during the webinar. You'll see me, but you won't see them, but they are really integral to making this happen. I have Tia Mata, who is with us from Kingston, Ontario, who is masterminding the tech. We have Mandy Walker, who's also a knowledge translation specialist, and she's across the hall from me here in Emmiginish, and Carolina Jimenez, who is in Toronto and helping us with the French recording on that side. So to let you know, there are many NCCDH staff who have come together for this event, and it takes a team to do something like this. So thank you. So with that, I will introduce Dr. Lorie Donelle. Lorie is an assistant professor at Western University in the Arthur Labatt Family School of Nursing. She's a scientist with the Lawson Health Research Institute in London, Ontario, and she's an inaugural member of the Fellows of Canadian Academy of Nursing. She holds an endowed research chair in nursing at the Arthur Labatt Family School of Nursing, and it's focused on digital health. Her research really addresses health promotion specific to issues of health and digital health literacy, social justice, and digital health broadly. Her research looks at technology-enabled models of home care and the relationships between health information technologies, client-clinician health practices. And she's a contributor to international and national advisory committees for health literacy and digital health on a regular and ongoing basis. So we're very lucky to have her. She was also an author in one of the chapters in the book. But before Lorie speaks, I am going to turn the mic to Irving Rootman, who is, I think, the godfather of health promotion in Canada. And Irv, I will get you to say a few words.
I wish you wouldn't call me God, but anyways, thank you, Diane, and hi, everyone. I'd like to start by acknowledging that I live, walk, and speak on the unceded traditional lands of the Musqueam, Salel, Watuth, and Squamish Coast Salish people. So on behalf of Health Promotion Canada, I welcome you to the 4th in a series of webinars based on the recently published book promoting the health of older adults, The Canadian Experience. Health Promotion Canada is an organization and community of people from across the country that aims to advance the practice of health promotion in Canada, and has organized a number of webinars over the last few years in partnership with the NCCDH, including this series. If you're interested in learning more about it, you can go online using the URL above the picture of the book. Next slide. In regard to getting a copy of the book, I'm pleased to announce that there will be a draw for a free book. Diane will pick a name from the list of participants here and announce the winner at the end of the webinar. Instructors, endorsers, book reviewers, and media can also request a complimentary copy. And those of you who have not picked for a free book can order it at a discount of 20% over the next month using the instructions on the slide that's showing here. So next slide. Before I give the floor back to Diane, I'd like to say a few words about the organization and content of the book. With regard to the organization, we decided to use the 5 action areas of the Ottawa Charter for Health Promotion as the framework. These action areas were formulated in 1986 at the first International Conference on Health Promotion. Although since then, there have been 2 other international charters related to health promotion development. The most recent one has not yet been finalized. In any case, the editors of our book adopted the original action areas because they felt that they are still relevant for health promotion and for other fields that promote health, such as gerontology, which in this case was important, given that the book is about older adults. As it turned out, this was a good decision because we found that the authors from other fields of study and practice were able to relate to one or more of the action areas. This webinar focuses on the 4th action area, namely developing personal skills. However, I want to stress that the other 4 action areas are important in enabling people to develop their personal skills, and there are references to them in all of the 6 chapters in this section. For example, the chapter on lifelong learning stresses the contributions of 3 domains of learning that are critical to healthy aging, namely the learning domain, social domain, and educational domain, and makes the point that all of these domains are critical in developing personal skills throughout the life course that are important for the health of the population, including the health of older adults. For another example, the chapter on community health and social services suggests that the value and benefit of health promotion programs offered by community-based, not-for-profit organizations and governments are critical in supporting older adults to age in place and remain as resilient, socially connected, and healthy as possible. The authors of this chapter also stress the importance of policies, including those related to promoting the development of personal skills using the Raising the Profile project as a case study. I don't have time to give you examples from the other chapters or action areas, but you can rest assured that they're all important in promoting the health of older adults. So the last slide. In conclusion, I'd like to say a few words about health literacy and let you know why we chose this to focus this webinar on digital health literacy. This slide has 2 definitions of health literacy. The first put forward by Don Nutbeam in 1998, who is an international leader in the field, suggested the first definition, namely the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health. It's still used internationally in the field. The second definition that was put forward 10 years later by the Canadian Expert Panel on Health Literacy, which I chaired, is the ability to understand, evaluate, and communicate information as a way to promote, maintain, and improve the health in a variety of settings across the life course. I'm not going to get into a fight with Don Nutbeam as to which definition is the best, because I think that they are complementary. Although I suspect that Don's definition is used more internationally. In any case, there are now many kinds of health literacies, including the one that we're focusing on today, namely digital health literacy. Why did we decide to focusing on digital health literacy? One reason is that we focused on digital health literacy is because Lorie is an expert on the topic, but more importantly, it's an equity issue for older adults who have the lowest level of literacy in the population, and it can be improved by using health promotion strategies in collaboration with other fields of research and practice. So with that, I'll give the floor back to Diane, and look forward to Lorie's presentation.
Thank you, Irv. Thank you. And with that, we'll go right to Lorie, Dr. Lorie Donelle. I will stop sharing my screen and Lorie will share hers. So over to you, Lorie. Thank you.
Okay. Thanks, Diane. Thanks, Irv. I'm just going to get situated here. And okay. So I'm hopeful everyone can see the slides. Thank you so much, Diane, for the lovely introduction. And Irv, I'm always happy to learn from you. I am located right now in Kitchener-Waterloo area, which is the Haldimand Tract. And this is the territory of the Six Nations here in Kitchener-Waterloo. I'm very happy to be here and to be able to discuss health literacy and digital health literacy that I believe underpins so much of our access to health information, health services, and supports. And I'm just going to begin my discussion today by positioning myself a little bit in this field and provide just a really brief background of the concepts that I use and that are foundational to the work that I do. So my approach to teaching and research is really informed by health promotion concepts, those of equity, power, empowerment, privilege, partnership or partnering with, and this really is to promote equitable and socially just conditions for all Canadians. And I think that is, I would suggest, in part the essence of the entire book. Within this, I'm really mindful that all of the choices or decisions that we make, including health-related ones, are really situated within the context of our own lived experiences. And with that, I acknowledge the diversity of opportunity and really the diversity of privilege that exists in some of the decisions that we make and among different people. And so the concept of equity is one that I'm going to thread throughout the discussion today and with this introduction really to health literacy and digital health literacy. So Irv, I do prefer kind of the Canadian-derived definition of health literacy, and as Irv said, it really is about accessing information, understanding that information, being able to appraise or critically analyze information, and then to be able to communicate information across different health contexts and across the life course. And today, of course, we're focusing on older adults. But I would say for all Canadians, but especially for older adults, those who experience some of the most complex health challenges, there is an expectation to engage in self-care, really self-health promotion, and to engage in shared decision-making around our healthcare that I think is dependent in part on having adequate literacy, health literacy, and more than ever before, I think digital health literacy skills. The information intense nature of self-care or self-health promotion, but the information intense nature of chronic disease management, I think really highlights the importance of having these skills to be able to access information, to be able to participate with confidence in decision-making, to be able to follow treatment plans that are appropriate, and simply just to be able to navigate what is becoming an increasingly sophisticated and complex healthcare system. And as I said, more than ever before, we are absolutely inundated with information from all kinds of directions. And we're using this information to make decisions about our health and, in fact, health-related issues. And along with Dawn Nutbeam and with Dr. Rootman, who we have with us here today, Ilona Kickbush is another pioneer in this health literacy space. And she states that we use health literacy, and I would include at this point digital health literacy, as a way to really filter and sift through the many and diverse health information resources that are available to us. There's a number listed on the screen. We know from research that healthcare clinicians or healthcare providers remain our primary and trusted source of health information. As well, family and friends have been and continue to serve as important resources for health information and particularly support. And there are so many self-health resources in the form of community libraries and self-help books. There's mass media news outlets, there's television, radio, magazines, newspapers, all important resources for health information. But I would suggest, and perhaps you've experienced as well, that more and more individuals are accessing the internet. They're accessing online websites, perhaps health organizational websites. They're searching online using search engines like Google, also known an alias as Dr. Google. There are so many social media platforms like Twitter, which has been in the news lately, or Facebook, or Instagram, or TikTok, that have really important health-related information and messages. So many people are using apps that are online and devices like smartwatches, heart monitors to self-monitor and assess health. And these are important. The digital health tools have significant potential to create benefits where, in fact, individuals can schedule their own health and medical appointments. They have access to their medical records and lab results. They can access information essentially any time of the day or night, 24-hour access. Online apps have been used and taken up, and they are in the millions with some of the app stores. These can enhance activity and fitness. They support our dietary choices. They support medication administration through some of the reminder apps that are available. They can enhance sleep in terms of some of the mindfulness and meditation apps. There's GPS mapping and even voice activated systems. And what I mean by that is Google Home or Amazon Alexa or Siri that we, sometimes carry around on our smartphone. These are available and useful to individuals who perhaps are visually impaired, or even individuals that are cognitively impaired, and offer greater mobility and independence. And people are meeting online. Online communities are really important in terms of supportive and information sharing spaces. But as Kickbush and Irv Rootman and others have reminded us, that adequate health literacy, and I would say digital health literacy in this day and age, is needed to access these resources. And unfortunately, and of concern, is that there is a substantial proportion of Canadians, and especially older Canadians, that are particularly challenged in this regard. but we are online. Over 90% or 90% of individuals 16 years to 64 years have online access. And some of the other research that I'm doing, we know that young children as young as 18 months are accessing devices and technology. And we know that as the age cohort gets higher, there's lesser use. And so we know that the highest use is among youngest age groups and the lowest use is among those 75 years and older. But we are online looking for health information. And this is some data from a national survey done in the US by the Pew Research Center. And it's somewhat dated in that it's 2013, so I would expect these numbers to be a little bit higher. But 72% of internet users are looking for health information online. And 77% of online health seekers are using search engines such as Google. Hence the name Dr. Google. But what remains, though, are significant challenges. And that is that it's interesting to know, and what these researchers found out was that about 1 out of 4 people seeking online health information are restricted to access this because of what they call a paywall. And this is where information that they're seeking requires payment to access it. Many Canadians as well, particularly marginalized populations and isolated communities, remain disadvantaged in terms of access to digital spaces. And people with limited access to technology, excuse me, are largely the same people that are traditionally underserved by the healthcare system. Sorry, I just have to take a drink of water here. And these are the same people that suffer the greatest health disparities. So I think we have important work to do. And we continue to learn that online access was not as it was promised, this kind of democratic space. It's not consistent, nor are we finding is it equitable. And what we're learning about is that widespread online information access has created this really paradoxical situation where, on the one hand, the general public has never in the history of time had access to so much information. But on the other hand, the complexity of information and the sophistication of the information makes it increasingly limited in terms of access. Even more so, and for me, this remains surprising, that the readability of online information remains quite high, and the ability to discern good information from misinformation or disinformation is incredibly challenging. And this has been particularly highlighted over the course of the COVID pandemic. And so in 2016, the Organization for Economic Cooperation and Development reported the following, this important challenge, and I think it's alive and well today, that there is a pervasiveness of digital technologies, and we are taking these up on a daily basis and becoming part of the fabric of our lifestyle. These are fundamentally changing, though, the way we access information and knowledge, and as they state, more fundamentally, in order to seize the new opportunities that these technologies provide, we need to develop the right set of skills to make meaningful use of these technologies. And we're seeing this within the healthcare sector that increasingly relies on digital technology to manage patient records, for communication purposes, and even to provide care through virtual and digital spaces. And it will be increasingly necessary, if not urgent right now, for all Canadians, but senior Canadians who want to remain or have greater involvement in their healthcare. They will need to become proficient in the use of not only digital devices and technologies, but also have the digital health literacy skills to be able to do so. So this concept of digital health literacy is very similar to the one that Irv introduced earlier on in terms of health literacy, and essentially is this ability to seek, find, understand, and appraise the health information from electronic sources or resources to address or solve a health problem. And the illustration that you see here is really an adaptation of a couple of researchers' work. Originally, Norman and Skinner, two Canadians, developed the original framework, which is the Lilly model that you see. And then Gildstad is a researcher, I think, from Norway. I'm not exactly sure, but one of the Scandinavian countries. And she talked importantly about some of the other components of this particular model. And I think it's important to be able to frame digital health literacy as a composition of different literacies, which include the knowledge and skills that are relevant to reading and understanding general information, which is the traditional literacy and numeracy in one of the petals. But the ability to use digital devices and have awareness of data privacy, data security, and increasingly more important, data ownership, all fits under kind of the umbrella of computer literacy. The ability to critically understand and assess some of what we're finding increasingly complex and sophisticated media messages fits within media literacy. And along with media literacy, is science literacy, which is the ability to discern what is reliable and valid health information from that isn't. And to be able to effectively source or resource information really speaks to information literacy. And health literacy really speaks to our ability to access information and services and supports, but essentially navigate what is an increasingly, I guess, complex healthcare system. So Gildstad has argued that to really refine and create a comprehensive digital health literacy framework, that we should also consider 3 additional literacies, and that is procedural, contextual, and cultural. And I'll really speak to the procedural one. And when Irv and I were writing the chapter on health literacy for the book, we really thought procedural literacy in terms of digital health literacy was important, in that it speaks to the ability to navigate and to use tools and technologies, again, relevant to aging adults who may be managing progressive physical disabilities, progressive vision issues, or perhaps mobility issues related to arthritis that really can impact our ability to use digital devices. I think Irv already alluded to this, but of the limited research in this area, and it is limited in terms of the research, particularly from a Canadian context, we know that older adults have the lowest digital and digital health literacy skill compared to younger age groups. And what we often see, or what I'm seeing in the research literature, is that individuals are reporting limited confidence in their awareness of online resources, their ability to seek information, but especially their ability to evaluate, to critically appraise information that exists online. So of that, I also just want to maybe ask more questions than provide information, but I think these are important discussion points. And I'll just highlight the fact that some health communication experts are claiming that our health and digital health literacy skills really determine, in part, the source of information or health information that we seek out. For example, individuals with limited skills tend to access more passive information sources, for example, television and radio, that typically or tend to require less cognitive effort and less engagement, whereas those individuals with more developed health literacy and digital health literacy skills also have the opportunity to access more active resources of information, such as newspapers and the internet, that typically require greater personal and cognitive effort. And so for me and for other individuals in looking at this space, this really brings into question a couple of things: whether the quality of the health information is different depending on the source or resource. So is the accuracy different? Is the amount of detail different? Is the clarity different? And I think beyond that, it gives us some pause to consider as perhaps public health professionals or health educators, or even providers and organizations, gives us pause to consider the information and the resources that we're providing or prescribing, if we're looking at information prescriptions, to the people that we're working with. I think it's also important to consider some of the costs. Financial costs for sure, in terms of people that are able to or not get online, able to or not purchase the devices, able to or not access some of the apps. But I think there may be costs, and there is some literature around the costs in health literacy with respect to health service utilization. And there's also, of course, costs in terms of healthcare outcomes. So for consideration, and perhaps for some of the conversation that's yet to come, is there a difference in the quality of health information depending on the source or resource? And should we, or is there something that we can be doing about that, at least considering that? How has the internet or social media or apps or some of the devices, when we think about our smartphone, or even some of the wearables, people that are wearing Fitbits, has this increased equitable access to information? Have devices like voice-activated systems, Google Home or Alexa, excuse me, or Siri, who we carry around with us if we activate Siri on our smartphones, have these increased or changed our access to information, and is this equitable? And one of the things that I always ask or think about is who is included and who is excluded in any of the processes and situations. And so, Diane, I'm over time and I apologize, but I think this really provides some space for some interesting conversation and questions. And so I'm going to stop sharing my screen here and get us back on track. Apologies.
No, there's no apology necessary. I was totally wrapped up in what you were saying. And I mean, time is flexible. And this is what we need to talk about. That was wonderful, Lorie, that was wonderful. And I had seen your slides and I read the chapter and talked to you a bit, but hearing you describe it, that helps me learn. And so I picked up on things that I hadn't picked up before. And I love that, I was calling it a framework, but the visual of health literacy and how it really acknowledges how the whole landscape has changed, right? And it really sort of adds the tech into a model that we're all familiar with. And I was really reflecting on the equity aspect of this. So we recently worked on a document here at NCCDH and a project around digital equity related to mental health and addictions services in Nova Scotia broadly. But as we dove into this situational assessment and we created this practice brief, and I think we're going to share it in the chat box here shortly, the issue of equity and digital literacy, digital services is so complex, and it's more than just access, right? And it's more than just affordable devices. It's more than just faster Wi-Fi and affordable Wi-Fi. It's more than getting it to rural areas, and all of that's important. But what I was reflecting on what you're talking about with older adults and some of what we heard in that project around racialized groups who don't feel safe using certain platforms because of the language that's used in those platforms, for example. Members of the LGBTQ community who also don't feel safe. So there's a cultural safety aspect of the digital platforms as well. There's also the aspect of, even if there's free internet in public spaces, folks who can't actually access it. So I'm thinking about all the intersections of that with what you've discussed around the literacy piece and then the extra challenge of older adults and thinking of the older adults in my life. So yeah, just more of a comment, but I really appreciate that. Thank you.
Yeah, thanks.
So I think what we're going to do now is we're going to transition to our breakout rooms. And as I had mentioned before, we had asked folks to sign up for breakout rooms, but what we're going to do is get folks to choose. So I am going to share my slide. Oh, there's my share screen. There we go. So what we want to do here is considering what Lorie has presented to us, considering some of the chat that's happening in the chat box and what we've all come to today with in terms of our understanding. Think about which topic you might want to dive into deeply to talk about how does all this apply to very key areas for developing the personal health promoting skills of older adults. What I would really encourage you to do is choose a breakout room that maybe is a bit different than what you already know. It's a bit different than what you're already used to working in. So for example, if you already know a lot about health literacy, but you don't know a lot about arts-based approaches to health, go to the arts-based group. If you already know a lot about physical activity, but you don't know a lot about disabilities, there's obviously an intersection there, maybe go to the disabilities group. We're very, very lucky at the breakout room facilitators. Many of them are authors of the chapters that are in the book, Promoting Health of Older Adults. They will introduce themselves more fully once you get into the breakout rooms. We did make a couple of changes. We added a breakout room on disabilities, which wasn't part of the earlier registration link. It was added in a little bit later on, but I think many folks may have missed it. The other change that we needed to make was that we don't have a group that will be French only language spoken. However, the simultaneous translation will maintain in the current room in the health literacy topic, but also we're very fortunate the breakout room on lifelong learning and adult education, both Michael and RB are fully bilingual and they've offered to speak in French if that's easier or desirable for anyone. And I hope that that will meet most of the needs of folks that are here that might want to speak French. So we're going into the breakout rooms with two guiding questions. Thinking about the digital literacy piece that we just heard from Lorie, how do health equity and digital health literacy intersect in your work on a particular topic? So how do they intersect when it comes to work on mental health? How do they intersect when it comes to work around disabilities? So we're trying to bring that lens to it. And the whole goal is to try and identify some really practical considerations and actions to address the digital piece, to improve it. What are some of the barriers? What are some of the facilitators and opportunities? We'll bring you back in 15 minutes. So we'll bring you back at the top of the hour from the breakout rooms. And we will ask each group to share just 1 to 2 minutes of what the highlights are. We're hoping that we'll also capture some of what's in the chat box and some notes that the facilitators take, and we'll be able to compile and share that with you. So for folks who are like me and want to go to about 5 different groups, we are going to try and share the highlights and share the resources with you. So with that, I think we're going to do it. Tia, are we okay to do the breakout rooms here?
Yes, thanks, Diane, and hi, everyone. We're all set here. So the facilitators are going to get sent away automatically, and then participants, you're going to have the option to choose your room. So just hover down at the bottom over breakout rooms and then click on the topic you'd like to join.
Thanks. You know, I think folks are back from the breakout room, and it's so funny. You know, we talked about maybe making them 20 minutes, and I thought, oh no, I think that's too long. And now here it is for our main group. That 15 minutes sure went fast, I find. So so I think now, you know, I love that folks still have their cameras on. If you're comfortable having them on, I think that's really great. And I think we'd like to hear just a really quick report back from the group. And if there are questions that you've got for any of the speakers, you can pop a question in the chat box. We can collect it. But let's see how it goes over the next few minutes here. So let's actually start with, not with the main room that we were all in, but let's start with disabilities. Jeanette, do you have a bit of an update, or can you give a bit of an overview of what you chatted?
Oh, sure, I will. Yes, we had a small but lively group and diverse backgrounds and a really wonderful conversation. I got so caught up in it, I neglected to hit save. So, Onell, if you could share that book, I think others might be interested in knowing about the book that you mentioned. So in terms of what came up just very quickly, in terms of dementia education, there was just an acknowledgement of certainly the generational influences around life course and where people are and how comfortable they are in terms of engaging with digital platforms in terms of health and then having access and resources. So they're generational influences. And then also, there was a comment about some older people being really, really intimidated around Zoom. For example, that when the Zoom bombers were happening, I don't know if people remember that, but it created a lot of intimidation and fear and people not wanting to engage specifically with Zoom. So that intimidation and anxiety. And then also one of our colleagues noted the interface design with various platforms needing work with respect to how the apps are designed and dexterity, and also discourse and descriptions and terminology, as Lorie was talking about the complexity, that we need to ensure that we use concepts consistently and that are accessible with respect to how we design. And also financing, of course, I'm sure that that comes up a lot across the board, that for people to have Wi-Fi costs money and internet, and also that we need to ensure to be inclusive of all people with disabilities, etc. And then just, I think that's good. I'll stop there. Thank you.
That's so super. I'm typing the notes so that we can summarize and send to folks. And, when you mentioned Zoom bombing, we had a really, really unfortunate incident here at St. FX a couple of months ago during African Heritage Month, where there was an online Zoom musical event, and it got Zoom bombed with some really awful racist comments and language. And so that's where my mind went when you mentioned that. And so again, when I think about the intersections of some of those other discriminations and especially racism with the experience of older adults, that's really good food for thought for around some of us have a great comfort level with Zoom, but it's not always going to be safe for everyone. So let's hear maybe from Michael and Arpi, lifelong learning and adult education.
Michael, you want to go or I start?
Sorry, I'll go. So there were really three points in our group. We had a very animated conversation, although I talked too much. The first is the barriers. And that organizations really have to think about those barriers. We heard a very moving story about somebody who wanted to take a course at a college online, and the institution said, well, you can only register, they want to take a course in person, but they could only register online. And even when they went to the college to talk to the staff just sent them back to the internet. So and then of course the other barriers we're familiar with of low income, low access in rural areas and so forth. So we heard about those things. On the positive side, we heard lots of stories about how particularly young people, but that intermediaries can work with older adults to enable, and so we heard about older adults making films. We We heard about youth helping older adults use the technology and the mutual learning that goes on. So it's a two-way street. And that if we could have policy and program initiatives to support more of that, we could easily lower many of the barriers. And then we talked briefly about how during COVID and beyond, that the digital tools that we have really opened the doors in long-term care facilities for learning and for social interaction. So lots of opportunities, I think we identified. Is that accurate, Arpi, or is there something I missed?
Absolutely, yeah, absolutely. It's really good, yeah. And the policy aspect is important because, you know, we don't think sometimes, like in the case of where the course is in person, but the registration is online. And then, you know, therefore, like registrars groups should be also sensitized to some of these. There are groups that we think that, you know, are not concerned in this process. It's important to think about that very much. Yeah. The other thing is one thing I was thinking about it, and it is because of the example you gave, Michael, is that, you know, when we talk about lifelong learning is also part of it is to prepare for the older times. As you're giving the example where you taught your older sister how to be digital savvy so that when she is away or when she is in COVID situations, etc., you could communicate. Therefore, like that reduce the isolation a little bit. So there is the preparation aspect also that we should be thinking before we reach age 88, maybe at age 60, we should be preparing how we are going to be at age 88. Although technology changes so fast that it's very difficult, but that is an important part to remember, that you prepare for the future, for your own future also. Yeah.
That's really wonderful. Thank you both for that. Yeah, and I'm thinking about a story that we heard during this situational assessment project we were involved in, about in terms of, you know, vulnerabilities and you know, the mutual learning and you know, we set up services. And we think that by setting them up online or free in a public space, you know, it's easy for everyone to get to. But during our assessment, we heard a really gripping story about someone who was standing outside of the library to access the free Wi-Fi, and then got approached by the police for loitering. And so, you know, how do we actually expect folks to take advantage? Now, this was a younger person, but I thought, you know, what if that person was racialized? What if it was an older person? So, you know, there are bigger issues around safety and use that kind of come to mind for me too. So let's hear from Claire and Jill around the arts-based group. You guys had a good showing.
We had a great group, and it was just you know, the time went so fast. We were just starting to get into some of the meat of it. So we talked, like what was apparent through some of the conversation is that arts is a rather unfamiliar tool to many, both around health promotion and the impact that can have as a health promoting tool, but also supporting health literacy. And there was the question raised, how is it a tool to support health literacy? And given that art in its many forms is such a powerful form of communication, and it's an accessible one, even online work, as we heard with people living with dementia, can participate in arts-based forms. So it's really a valuable tool that I think gets overlooked. And I think there needs to be more learning and more opportunities of learning with artists around what the potentials are for that. So there were quite a few of us from one project based out of Vancouver working with a diverse range of seniors and a diverse range of artists and art forms that has gone on now for about 15 years. And what the pandemic pushed was this huge change from these in-person groups, and the creativity that the artists brought to changing it up. How can we meet the needs of these seniors? How can we communicate with these ones, moving from snail mail right up to very sophisticated online forms? So without going further, there's just so much more in that. And yeah, looking forward to further opportunities to pursue it.
I'm just going to add one thing, that when you're working with the arts, the opportunity for the health sector is also to gain literacy about seniors, especially seniors who come from non-dominant media culture. We certainly found in arts and health that was true with the LGBT seniors groups. They informed the health community quite significantly, as well as working with the First Nations elders. We are on Musqueam, Squamish, and Tsleil-Waututh traditional unceded territory.
And I think our website will be posted in the chat here, so anyone who wants to know more about the project can look there.
Yeah, thank you both very much. And, you know, I'm thinking, Jill, what you just said makes me think about the importance of, you know, engaging directly with the community. And that was mentioned, I think it was Michael that mentioned it under the lifelong learning piece, you know, that the mutual learning and learning, you know, allowing older adults to inform our efforts, not thinking that we just are the ones that need to inform everyone else, we being public health or health professionals, right? So that there's mutual learning that needs to go back and forth. Peggy, how about a little quick report back from physical activity?
Great, thank you. Well, we also had a small but dynamic group, and representing the field, public health, research, universities, recreation. So we should have had longer, Diane. It was a great conversation, but we needed longer. So just a couple of key points. I mean, I think the main thing we talked about was everybody knows about the shift in terms of physical activity during the pandemic from in-person to online. And there's a major shift. And there's some good evaluations going on. We had some examples of good programs, successful programs that are being shared across the country now. But we had a conversation. There's positive and negative effects of going from in-person to digital. And of course, the negative effect, the most thing, is being with people. I mean, a big opportunity for physical activity is the social interaction, is the social connections. You know, I can't tell you the number of older people I talked to who said, I just want to go and play pickleball. You know, doing an exercise in my living room is not the same. At the same time, people said that these online programs were very successful in terms of, and even in terms of social interaction, by using the format we've used today with small groups, that people were able to get to know each other and interact. So it wasn't perhaps as good as in person, but it was really good. And of course, they got the physical activity and they were able to do it in their home. So for example, I live in Ottawa. During the winter, like you know, even if your recreation center was open, you couldn't get there because of the snow and ice on the sidewalk. So it was democratizing in terms of allowing more people to be involved. However, the other side of it, the negative side of it, was what Lorie talked about, and that's the inequity issue. And that the people we see on these kinds of online physical activity programs are those people with resources. And so that's an issue. As I mentioned, there was a couple of good examples that we'll put in the chat box that we can share with you. Some of them are being shared across the country, which is exciting. For example, a program that started in the Atlantic regions being shared in BC. We didn't have time to talk about digital devices, but I do want to mention it. The whole issue of the Apple Watch, the counting your steps, counting your sleep patterns. I mean, this is a major advance in terms of health promotion. And we need more research. We need to look at how older adults are accessing that.
Yep, I totally agree, Peggy. That's really important. Thank you. And that intersection between or that importance of the in-person piece. It's not just getting the steps in, right? It's the in-person piece and the interaction that goes along with it. Doris, have you had a quick update for us from the healthy eating group?
Yes, we had just two folks, but two Nova Scotians, Jen and Dorothy. And one thing that we had a rich conversation, just far too short. We were just getting into it. One thing that was off the top, we recognized that our professional lives have reflected life trajectories from dealing with younger age groups, pediatrics, right through now to aging and older adults. And there's a lot of lifelong learning within that help give a really interesting lens as we look at some issues. And we spoke quite a bit about equity, in particular about parts of Nova Scotia where there are older population groups, and they have real difficulty with access to internet, access to actual learning opportunities. So real problems in terms of developing digital skills. And we linked that in terms of looking at food literacy and the neglect of understanding food literacy from a digital health literacy perspective. And that really dovetailed very much with food security concerns, and really seeing that the personal kind of skills and opportunities for healthy eating are really tied to broader systems issues too. And so we have to be making those connections, and digital skills are really part of that, and a better understanding of what digital health literacy means. Hope I've given a quick summary of some very rich conversation.
Yeah, it's funny that 15 minutes is too short, even with three really passionate folks, right? And that, you know, what you just said, the dovetail of food literacy from a digital perspective with food security, that's, you know, I'm a dietitian too. And so that is a layer I hadn't fully appreciated. So that's really great. Thank you. So let's hear from Fran from our mental health group. Fran, you are muted, love. Sorry.
I'd like to thank our group. It was really dynamic. It was large, and not everyone had a chance to chime in. But the first thing that we identified, the barriers around mental health being stigma and fear about accessing any kind of resources, particularly for people from racialized communities, marginalized communities, and many of them are older adults. The other, of course, is the fear of the digital world and not really being feeling safe to use it. That said, there were three amazing resources that our participants talked about in the short time we had. I think there were probably more. And if I could just ask those who who talked in the time we had, if you could in the chat room put your resources out for people. The first one, the question about dementia and access to information for families, caregivers, even people who may have a diagnosis of dementia. How do you get information? And one of our participants spoke about the Alzheimer's Society of Canada. There is a wealth of resources and information that is accessible and definitely needs to be tapped into. Not everyone knows about it, not everyone can access it, but if that's possible, then there's lots there for all those affected by dementia. The second example was from a woman who talked about also the Alzheimer's Society, but the culturally based information that is being developed. There's great recognition in the Alzheimer's Society of the need for information in many different formats, languages, and it is being developed and it is out there. And again, you know, people need to know how to access it. And then we get to the equity issues of people who don't have even access to a computer to tune into those resources. But they're rich and they're out there. And a third participant talked about a really innovative program in Victoria for the homeless community, many of whom are aging people who are still, many of them living outside. They were given cell phones during COVID. All they had to do, I think, was go to a 7-Eleven store. They could get a cell phone with credit on it. And for many of those people, I think they still have the cell phones, and some of them have been using it to access help, resources, and information. But even many of them did not feel safe using a cell phone. Many of them sold it or gave it away. So those were 3 examples of some, you know, resources that exist in our communities, examples of how to reach people. And I would love it if those people who talked could put their information in the chat room so that we can get that out to all of you, because I think we do have information and resources, but we're not necessarily providing enough access to those. So that was, and we could have gone on for a long time, and I think 15 minutes just flipped by, but
You know,
there's lots going on in the mental health area. And I really
so maybe,
appreciate it.
yeah, and maybe Fran, you'll send me those notes, and I can already.
Yeah. I
Wheels
will.
are turning. They're turning about having another webinar series. I can already see it happening in this slide right now.
Yeah,
so let's hear from our final group, which was our health literacy group in the main room here. I took a few notes, but Lorie and Irv, what would you like to share from that discussion?
Irv, did you want to go first?
No, you go first.
Okay. I think we had some similar conversation really around some of the challenges to access, whether or not people could get a hold of technology, and then of course, once, if you can, whether or not you can access the information that has utility or is usable. The other thing that stuck out for me was the idea that it's not that older people don't want to learn or don't have the ability to learn how to use the internet or access information or even some of the devices. It's the process of learning and how that's structured to align with the cultural needs, kind of the cognitive differences that naturally occur with aging, and so just a greater amount of time. And what Irv and I knew from the research literature that kind of the hands-on as well as the instructional component of it is important in terms of some of the learning. So the other thing is looking at the entire ecosystem, and that it's not, the accountability does not sit only with older adults in terms of they are accountable to learning and development, but that we as an entire system need to be thinking more about how we support all Canadians, but especially uniquely older Canadians in terms of the digital health spaces. And literally have not even begun to address some of the devices that were just briefly mentioned today. and Doris, I think with some of the food literacy, the food security, some of the, what do they call them, food deserts. There's lots of mapping around food deserts, but then food swamps in terms of where there's just such pockets of perhaps not the best nutritional content food, but that there is some relationship with some of the marginalized and disenfranchised people that we're finding those associations. And so I think there's just an incredible opportunity in this space to do better.
Yep, totally agree. That's a beautiful way to end our conversation. Unfortunately, because here we are at the end of 90 minutes. So I have two things.
I think Irv needs to say something.
Oh, I'm sorry. Oh gosh, Irv,
sorry.
Yours.
Yeah, I just want to thank Diane for getting us through this wonderful webinar, and the National Collaborating Center for supporting it. And I just want to end with a personal comment. And as an 80-year-old person, the best thing, one of the best things in my life, my wife being the first, but is my computer. And it also is one of the worst things in my life, because every time I try to get onto the bloody computer, it's changed and it's driving me crazy. But anyways, I think that echo some of the comments that I heard in our session and in this session right now.
Yeah, and I'm laughing her because only because it happens to me too, you know, and I can't imagine how difficult it is for some people to sort of make sense of this digital world and have it function in a way that's works for them. Three things I'll add. We had a comment that I'll just in the chat box that I'll offer up for consideration. Someone commented, you know, I'm curious about whether some of the reluctance to use digital technology comes from that historic practice of where the doctor sort of did everything for the patient, which is, you know, a medical model type of approach, but that's, you know, where a lot of generations and a lot of decades have come from. And so just as food for thought going forward, you know, maybe it's more empowerment, maybe it's more skill building, definitely more skill building for older adults. I want to let folks know that I drew a name for the door prize, and the winner is Leah Sandals, who is, I can see on the screen right now. So Leah, I'll send you an email to get your address for the publisher to send you the book. And I also just really want to thank Irv and Fran and Peggy and Melanie Levasseur, who's the other editor of the book. And this partnership between NCCDH and Health Promotion Canada is it's getting stronger and stronger, and it's been one of the most enjoyable pieces of my work in the past few years. And you know, without computers, you and I would never have met and had conversations.
Right. That's right. So, and I wouldn't have been able to keep in touch with all my friends for over my decades in health promotion.
Yep, it's a great relationship builder. And I will, someone has asked a comment, or in the comment box, will the slides and presentation be available? Yes, so I'm going to look into the slides piece. Definitely the recording will be available. We'll send you a follow-up email. And with that, just thank you very much, everyone, for your attention. If